Hey guys, I'm Dr. Matt Tonis, and I am here to share with you 3 things that you can potentially be doing at home to help with the function of your neck, which hopefully will then take away a little bit of the discomfort that you're feeling. So first of all, a lot of the time, the neck will struggle with compression and almost what feels like a pinching nerve or a joint that's not gliding properly. So what can happen is you go to turn and you feel like something's just jamming up. A great way to try to open and release that is to sit on a firm surface. I'm using a piano bench here, but you could use a dining chair. You can use anything that's a nice firm surface. Get that low back arch, sit nice and tall, and anchor one of your arms underneath the surface. So that's going to help hold your shoulder and the musculature here in an anchored position. The next thing you're going to do is you're going to turn your head at a 45-degree angle away from the anchored arm, and then from there you're going to tuck your chin and start to move your head down as if you're looking at the armpit of the opposite side. What you should feel there immediately is a tension that's a stretching type feeling on the side of the anchored arm. Hold that for about 8 seconds. Once you have done that, back it off and then repeat it again. You want to make sure you at least repeat it twice, if not 3 to 4 times, in order to just increase the flexibility and decompress that area. Then you're going to go to the other side. Even if only one side's painful, make sure you do both. Anchor arm, turn away, look down. Very nice stretch. Okay. The second thing is you want to move your neck within the confines of a comfortable range of motion in order to make sure that you're engaging things, in order to make sure that you're circulating fluid through that area. So let's say I have a restriction in turning towards my left side that only lets me go this far. What you want to do is you want to do healthy movements that take you to the edge of that discomfort and just help to get movement in that area. Part of healing and recovering is getting fluid to exchange so that inflammation doesn't pool in an area. If I can go further to the opposite side before the pain sets in, then I'm going to go far to that side. The next mobility motion is going to be tucking the chin and arching the neck backwards. Again, just staying within a pain-free zone. If you can go further back before any pain sets in, take it that distance. And then the last one would be a side-to-side ear bend towards the shoulder. So that's called lateral flexion. And so you want to try to go through rotation, flexion, extension, and lateral flexion from side to side within the pain-free zone in order to move fluid in that area and take inflammation out of there. The last thing that I would suggest that you would do would be a little bit of isometric strengthening. So those exact same ranges of motion that I just showed you can be helpful, but without any movement at all. So if I was to place my hand on the side of my head like this and turn into my hand, I'm going to engage some of the musculature without moving the joints. Activating the muscle in that way creates stability, and stability is oftentimes very helpful in terms of improving neck function as well. So you're going to go a little bit left rotation, okay? Right rotation. Lateral flexion. So now I'm pushing into my hand this side, and I'm pushing into my hand this side. And then flexion extension direction as well. So I'm pushing into my hand this way, and then I'm pulling back into my hands this way. That's the only one of those that's strength oriented to activate some of the supporting musculature around the neck there. Of course, each individual condition requires individual things that actually target those deficits. So the only way to know exactly what your dysfunction is to have a proper assessment done so that you can determine where the challenge and the weakness is. And then from there, you can very deliberately come up with the right things that a person would need. I hope this at least helps you a little bit.